I want to look at this morning is the area of supervision. When things are of a more normal time, one of the tenets of social care practice is the supervision process. And the supervision process that's most used in social care is the Toni Morrison model. And the Morrison model tends to be a strengths-based approach to supervision. It tends to be very collaborative. It's a two-way street. It tends to be very learning-focused. It shouldn't be about blame. Certainly it should be about accountability, but it shouldn't be about blame. And when we talk about accountability and supervision, the accountability is also a two-way street. The supervisor is accountable for initially setting up the supervision process, for introducing the concept of a contract. Supervision should be a contract between the supervisor and the supervisee. The supervisor is responsible for the note-taking process and how they are safely stored, and then is responsible for agreeing the time frame every 4 weeks or every 5 weeks, or at the most every 6 weeks. They're generally responsible for the setting. Where does the supervision process happen? And then the supervisee is responsible for, I suppose, mostly their personal integrity. What are you going to bring to the supervision process? And then when you're working within the supervision process, the level of honesty that you bring to that process. In my supervisions, I supervise a large part of the team that I work with, and when I'm setting up the initial contract, I agree with the supervisee that we are 100% honest with each other. I also give them permission to be critical of me in this process. So if there's something that I'm doing that they're not happy with, that they have my permission to be critical with me. And I ask them to give me permission to be, if necessary, critical of them. But I don't mean critical from a negative perspective, but from a critiquing perspective. So in these very difficult times, I'm watching you guys on social media, and I'm seeing an awful lot of fear and hurt and anger and a little bit of a herd mentality. So, you're coming to social media, which is a very normal thing for most of us now, the use of social media. But you're coming to social media and you're venting, and people are piling in with the venting. And that just leads to more venting. And I'm sure sometimes by the time some of you come off social media, you're more distressed than when you came onto it. So now as a supervisee, you're responsible now to start using your supervision the best way that you can. Bring your fears to the supervision process. Hold your supervisor accountable. If there are stresses or if there's things not happening within the organisation, address it first in the supervision process. Make sure that it is noted and written down. Do not sign the supervision document until everything that you've asked to be done is actually typed down and who's responsible for doing that. So if you agree a process with your supervisor and they say, yes, I'll go and talk to management, or I'll go and talk to the directors, or I'll go and do that is actually noted. And if they're in turn asking you to do something or to take part in the process and you agree to do that, that's signed off on as well. So as a first base in a time of crisis, do not fail your supervision process. Hold everyone accountable, hold your supervisor accountable, and then through them, ask them to hold other people accountable. Leave your fears in the supervision relationship, and that's what it's there for. I'm going to do a few more of these over the next little while, and if there's any topics in particular that you want me to cover, let Social Care Ireland know, and we'll look at doing that.